Welcome everyone to Chow Entertainment. We have a pleasure of talking to a special guest today. He is an ER doctor, lawyer, and UCLA professor, as they call him, as a triple threat. Everybody would say that, right? Well, he is also the founder of course, Healthy Charity, Bodhi Global Telehealth. And we'll learn more about this as soon as we speak with him. We want to give him a warm welcome. Please, let's all welcome Dr. CARLO Reyes. Hi, Doc.
Hi.
How are you?
I'm good. Thank you for having me.
You're welcome. It's such a pleasure to have you. I would love to know more about you, your family, and of course, all the things that you've accomplished and your current project that you're actually having right now. So my first question is, could you kind of tell us a little bit about yourself?
Sure. Well, I'm born and raised in Los Angeles, California. My family from the Philippines. I have 3 brothers who were born there, and then we emigrated here in the late 60s.
Wow.
So I went to high school in La Crescenta Valley High School, and then I went to college at UCLA. And then I pursued my medical degree in Chicago Medical School. Then did my training, went back to UCLA, did my training in emergency medicine and pediatrics. It's a dual residency.
Wow.
I've been practicing medicine for 19 years, and then I started doing mission work for the past 9 years.
Wow, that's pretty amazing. I'm not going to ask how old you are, but of course age doesn't matter. I hear that you come from a very successful family, from parents to siblings, all doctors, I believe, yes?
Yeah, my father's a psychiatrist. He practiced for many years, still alive. My mom and dad are still alive and well. I have 2 brothers who are psychiatrists as well. I was supposed to be a psychiatrist as well, but elected to be the black sheep and go into emergency medicine.
Wow.
My mother was a nurse and a teacher, an educator. So yeah, lots of healthcare in my family.
Wow, that's pretty amazing. I'm pretty sure it's so good and to be, surrounded by a lot of professionals in a household under one roof. And that's, how long have you been actually practicing as a medical doctor, and where is your practice?
So after my training, I went to moved to Thousand Oaks. I am the assistant medical director of emergency medicine at Los Robles Hospital. I've been there for 19 years, a long time.
It is.
And I was vice chief of staff at the hospital for a period of time. And I've done various medical activities. I'm the president-elect for the Ventura County Medical Association as well.
Wow, you have your plate full.
2 plates.
Yeah, well, it's such a pleasure for you to just take the time to talk to us. I'm really, really grateful. So how long have you been practicing as a juris doctor?
So I had always been fascinated about law. So while I was practicing emergency medicine, I did a part-time day program at Southwestern. And then I got my degree in 2010, sat for the bar. So, passed. So I practiced law for about 4 or 5 years, but kind of part-time while I was also practicing medicine. It got difficult to balance the 2. So at this time, I'm, doing like some consultations, and, I'm still with a firm in Oxnard. And so if they need my help with certain things, analyzing cases, things like that, then I do that. But for the most part, it's very part-time for right now.
Wow. I can imagine already the stress that comes along with it, but I'm pretty sure you wing through any type of work. So my question too is like, since you're a doctor, a lawyer, and a UCLA professor, which one of those positions do you actually love doing? I mean, which one would excel among the 3?
Oh, it's got to be my practice in emergency medicine. I was UCLA faculty for about 10 years, and then as I transitioned into law school, I had to put that on hiatus. And so I have a lot of experience in teaching as well, which is a lot of fun for me. But the practice of emergency medicine, and then I've kind of evolved into really getting very excited about medical missions because I could use my skills as an emergency physician. I get to travel and I get to make a really impactful difference, with and hopefully inspiring others to join me.
Well, that's great. I'm pretty sure that once everybody sees this and watches this, I'm sure to be contacting you, asking all this information and how to go about it. With everything that's going on in your life and all the responsibilities and the duties, and especially your goal in this mission, going back to your family and of course, about yourself. Are you single, married? Do you have family with everything else that's going on, it's pretty much a lot. That's like a handful.
Yeah.
So sometimes it's kind of hard to have, family and other tasks and responsibilities as well.
Yeah. I'm currently seeing someone.
Oh, okay.
I am previously divorced.
Okay.
I have 4 kids. And obviously very active with my kids. They're all, 3 of them are either graduated from college or in college right now. And I don't know, did that answer your question?
Yes. I'm really thankful because a lot of people would evade that question when it comes to anything that's personal or relationships. But thank you, Doc, for enlightening us with that. My next question, of course, would be healthy eCharity.
Yes.
Would you tell us more about it?
Yes, absolutely. So myself and several other physicians got together and started a nonprofit. We wanted to be able to go wherever we wanted to go, make an impact wherever we wanted to go. We had previously partnered with a particular NGO in one region, but we wanted to see other places. So with that, we started just working with contacts with our networks, and it just kind of grew. It was something that I didn't expect to happen. At one point, I thought it was just going to be one place, and just a handful of people, and we would just, but now we've been to amazing places. We've been to India, Haiti, Iraq. We were actually the first. Healthy Charity was the first American medical mission team to serve in the Yazidi camps in the Kurdish region, and we're still doing work there. We're actually launching our global telehealth application, Bodhi Connect, in the Kurdish region. So there's lots of work that we're doing there and in other places. So it went from this kind of small idea with a couple of friends to quite big, but we're still a small organization. We're under 15 people and none of us get paid. We just fundraise and we do what we want, what we're have passion to do.
Well, like I said earlier, I'm pretty sure once this is out there, a lot of people are watching and get interested in your mission, there'll be a lot of help out there, and you're going to be able to bring this worldwide and help a number of people as well. So you've talked about Healthy Charity. Would you expound more about the Bodhi Global?
Yes, absolutely. So we wanted to maintain sustainability. So the challenge with medical missions is that you're there, you make the impact, you're there for a week, 2 weeks, a month, and then you leave, and then it takes many months to get back there, and there's that gap where there's less help, there's not that much impact. And so we decided to use Bodhi Connect as a means to stay present all the time. We're using that application, and we're searching out volunteer physician specialists all over the country. And we've already grown our network of volunteer physician specialists that will be available when we go on missions and when we come back to continue that care. So it's a unique approach to medical missions. So it's really like, doing medical missions even without having to step on a plane or travel. So we are able to do both in-person and virtual missions.
So do you have like a special website where people can look more into it, or a number where they can reach you? Or are you accepting any other members to help in, maybe volunteers as well?
Oh, absolutely.
Yeah.
So our website is health-e-charity.org. And within that site, you'll see all our prior missions. You can get to learn more about what Bodhi Connect is about. There's applications for becoming a mission volunteer, for sponsorship. We have an amazing gala that we're planning for on November 12th. Recently partnered with the Manny Pacquiao Foundation, and they're providing us tremendous support in terms of contacts and donations to help us launch our first mission in the Philippines.
You actually answered my next question.
Been eager to get to that point.
Well, the gala, I'm pretty sure, is going to be spectacular. So I believe that's going to be November 12th.
Yes.
Yeah, at the Hilton, West Hollywood, right?
Actually, the venue has changed. We're
changed.
excited. We're going to be launching it at the new Mart building in downtown LA.
Oh, okay.
That's the home of the LA Fashion Week, and incredible organization. They're also a nonprofit. When they heard about what we're trying to do, they just got so excited, and they're helping us out, and it's just going to be a great evening. The venue is absolutely spectacular, and we're so excited to have
I'm
it.
pretty sure there's going to be like a whole number of celebrities as well, Filipino and mainstream.
I mean, I don't know. I can't promise anything, but I think that the recipe is there for a lot of presence, in that arena. Yes. Yeah.
Well, since Manny Pacquiao is in cooperation with, your mission, will he be attending the event as well, the gala?
I really hope so. There's been talks about it, and he's obviously a very busy person. I'm just I have so much gratitude to even be mentioned next to his name, and that would be my hope. But
Well,
we still,
cross fingers.
yeah, exactly. Yeah.
Well, always wishing you luck and to have this go further. How far do you think you see this go, and in terms of your goals and just basically your mission?
So in a way, the mission never ends. We just go from one location to the next. From the perspective of bridging that gap to care, either through in-person missions or Bodhi Connect, we're just going to go from one place to the next. I mean, we're excited about Philippines because we have such amazing access through the Manny Pacquiao Foundation and its connections. We hope to have, nationwide presence there over the next 2 years. We hope to expand Asia, all over the world. And that's really the purpose of Bodhi Connect.
Yes.
There's just so much need for specialty medical care that we believe that this is a very viable and sustainable method to bridge that gap. So we're excited.
So once you'll be doing the mission, that would mean you being an ER doctor would be put on hold, and you being a UCLA professor would be set at the side as well. So lawyer, so where that comes in.
yeah, everything is on hold when I go, and it's a little tough. I have to plan it out, and but it's my way of expressing devotion. It's my way of donating my specialty, my time. So it's becoming a very big part of my life. So I love it.
Well, I commend you. I applaud you for all the hard work. I will wish you a lot of luck, that this will go further and further more, and a lot of people will come and join you in this, mission. Would you like to invite all the people that are watching right now, especially within the community, Filipino community?
Well, I personally invite everyone that's watching to learn more about Healthy Charity, to come to the gala. It's going to be an amazing evening, and if you come, then definitely reach out and say hi.
Thank you, Doc. So is there anything else, last information that you'd like our viewers to know that maybe we have missed out on?
I think we've covered all the
everything.
bases. I am I think we have upcoming missions as well. So if we're looking for physician specialists that are interested in either joining us on our missions or becoming volunteer virtual consultants. Our teams include nurses, dentists. We also have non-medical support. So the team is really both multidisciplinary and medical and non-medical. So anyone that has a heart to serve, definitely reach out.
Thank you so much for your time. It's been such a very productive and educational afternoon with you. We wish you, again, the best of luck. And please, everybody, reach out to Dr. Carlos Reyes. And, this is going to be such a wonderful mission. And looking forward to the gala and seeing everybody there. And thank you guys for watching. Check us out again next time. Join us here at Chow Entertainment. I'm your host, Grace Aguilar.